Here we'll talk about the functions of health worker and health assistant male. So first comes medical officer of primary health center. Under him health assistant will be working, and under his guidance of health assistant, health worker will be working. And under health worker you will be seeing this ashas and dyes and all, right? Now let us see about health worker male. So one health worker male is given for one subcenter, will be covering a population of 5,000, and if it is a tribal or hilly area he will be covering a population of 3,000, right? So for one subcenter there is one worker, health worker male. And coming to the health assistant male, so he will be covering this 30,000 population and 20,000 population if it's a tribal or the hilly area, and he will be covering 6 subcenters and each subcenter with one health worker male. If you see the functions of health assistant male, the main function is to conduct camps and organize these programs, awareness programs, IECs, immunization schedules at school, radical treatment, and also he ensures this complete coverage of treatment in the people suffering with leprosy and TB, whether they are taking this medication regularly or not, he'll ensure that. And also he'll verify the work of male health worker. Here first we'll talk about the male health worker, functions of him, and then we'll see what the health assistant will be doing. Coming to National Vector-Borne Disease Control Program. So under this program, health worker will be collecting thin and thick smears of blood for malaria, and he'll be administering some radical treatment. He will be participating in spraying operations. He will be guiding ashas and all for the spraying operations. But this is under the guidance of health assistant, right? Remember it. And also he ensures about this Japanese encephalitis, Kala-Azar, leprosy, and basic health education will be given. He'll also tell the importance of self-care, food care and all. He refers to the health assistant and PHCs and CSCs if there is any serious case. And also he checks the completion of treatment. But whereas to ensure this completion of treatment is a function of health assistant, right? So he checks for the TB cases, symptoms, early diagnosis, treatment, and ensures treatment completion by dots under ASHA. He also trains ASHA for this dots, right? So basically what is happening here, ASHA will be guided by health worker and health worker will be guided by health assistant. Now let us talk about the functions of health assistant male. If in case this health worker fails to collect any thick or thin blood smears, then this health assistant will be collecting them. And also radical treatment, the plan and execution is started from this health assistant. He plans and execute this radical treatment and it is implemented by health worker. And the spraying operation also is under the surveillance of health assistant. So he will be guiding this health worker and ashas how to perform the spraying operation, right? Spraying operation is basically malathion, DDT, spraying operation for mosquitoes. Health assistant male will go to house, at least he covers 10% of the houses to verify the work of male health worker, right? The mass drug administration guidelines are also given by health assistant and he is responsible for completion of the treatment. So this health worker will be just giving the medicines to the people. This health assistant is responsible for completion of treatment. So he ensures complete treatment. So even in case of TB cases, he'll ensure the complete treatment. But if in case the people are not taking treatment properly, then he'll refer those cases to the medical officer at PHCs, right? Coming to the National Blindness Control Program. First, this health worker will identify all the blindness cases and also cataract cases and refers to the health assistant, and then later health assistant will be referring them to the medical officer of PHCs, right? Coming to the reproductive and child health care. So health worker will be collecting all the information about this eligible couples and child register, and he'll teach the people about this family planning. He'll distribute condoms, OCPs, contraceptives and all, and he'll educate the people on this medical termination of pregnancy, abortions, right? And also he'll provide services for the sterilization for males and females, and identifies and refers any cases of STDs. Also identify any low birth weight babies or the malnourished children, and he'll give proper treatment to them, like he'll advise the mother to breastfeed and properly feed the child. But if there is any serious cases, he'll refer them to the health assistant. Later health assistant will be referring them to the medical officer, right? So if you see the functions of health assistant here, health assistant will be organizing camps for the family planning, and also he guides the health worker in establishing this report holders. What we have said, this health worker will be distributing condoms, OCPs and all. So who will be giving this condoms and OCPs to the health worker? It is health assistant. So he guides health worker establishing this report holders. And also if any cases of STDs are found, health assistant will be following up them. So in case of any low birth weight or the malnourished cases are being referred by the health worker to the health assistant, then this health assistant will be referring these cases to the medical officer, right? And also he will be providing iron and the folic acid supplementations to the pregnant mom and all. Now coming to the immunization. Health worker will be giving DPT, OPV, MMR, BCG vaccine to the children and tetanus toxoid to the pregnant. Coming to a health assistant, he will be conducting this immunization at schools. So his main functions are three things. One, to guide this health worker. Second, to conduct camps and immunization at schools. And third, to ensure completion of the treatment, right? So he is conducting this immunization at schools. Coming to the environmental sanitation, health worker will be participating in this chlorination of the well, sanitization, uses of latrines to avoid the soap and defecation, education and awareness of the people in the community. Also, he'll be teaching people on proper disposal of the waste. And what will be the health assistant doing? He will supervise the health worker, and also he'll help in construction of these wells and latrines, right? Coming to the communicable diseases. So first, if this health worker is going to home and home, he will be talking to every one of them, right? So he will be knowing if there is any communicable diseases in the community. So if he finds out any communicable disease, first he should notify it to the health assistant and then medical officer, right? And also if there is any case of diarrhea or the vomiting, he should distribute oral rehydration solution. He should counsel people about HIVs and STDs because they are communicable diseases, and education awareness should also be given to the people of community. Coming to the health assistant, he will be alert to sudden outbreaks. The assistant will be always ready to treat the sudden outbreaks. We will be having these remedial measures and destruction of stray dogs. So these are the functions of health assistant. Coming to the vital events and the record keeping. So this health worker will be having registration of all births and deaths in that area, and he will be educating people on why this is important. Why the registration of birth and death is important, he will be teaching the people. Coming to the record keeping, health worker will be properly keeping a record of what is the treatment given to these patients, whether the treatment is being completed or not, to keep the attack rates and also to check the epidemiology of the diseases. So it will be helpful in epidemiology and checking the attack rates, right? So he'll be keeping a record of all the diseases happening and if the treatment is taking properly or not, right? Now coming to the health assistant, he will be guiding this health worker for proper registration of birth and death and also for the proper record keeping. And also he will review the records which are kept by this health worker, right? So if we see the extra functions of this health assistant, he will be supervising and guiding male health worker, right? We all know about it. And then he'll strengthen the knowledge of male health worker. He'll improve the skills of male health worker. He'll assess monthly progress of this male health worker. So he'll be just like a teacher to this male health worker. He'll supervise and guide him. He'll strengthen the knowledge. He'll improve his skills. And monthly, he'll check the progress of this male health worker. And he goes to house and house, verify if the male health worker is doing proper work or not. And he organizes these activities. He's organizing these camps, immunization at schools and all. And teamwork and coordination with male health workers and ASHAs, right? And he conducts staff meetings. He ensures proper placement of supplies and equipment at the sub-center. Under one health assistant, there are 6 sub-centers. And under one sub-center, there is one male health worker, right? So this health assistant will be providing all the supplies and equipment to each sub-center. Even in that point, you can see he's the one giving this condoms and OCPs, contraceptive pills, to the male health worker to distribute, right? So he will be establishing this depot holders. So here he will be ensuring placement of supplies and equipment at the sub-center. So this is about male health worker and health assistant. Bye.